Guys, welcome to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo in partnership with AIT. Together we fight, together we win. What we're talking about today, early detection and screening, patient and gynecologist perspectives. As you all appreciate, it's more about understanding both sides of the coin when you talk about cervical cancer. And I think on Monday was cervical cancer awareness, beginning of cervical cancer awareness week. So we have to be talking about this, and let's look at what we can do. But before we go into that, let's talk about our giveaway. Giveaway is coming up next week. So those of you who want to be in the giveaway, get ready, watch the space. It's only for those in active treatment. Please, it's only for those in active treatment. Give away 50,000 naira, given away by Congo Cancer Foundation's sponsors for anybody who is going through treatment. So let's get on with it. Let's look at what we're talking about. Cervical Cancer Week, as I said, started on the 20th of January and we'll be running through for the rest of the week. So get involved, get engaged, participate in what's going on in your communities, get to understand what's going on in your communities so you can actually be part of what's going on. And let's start this conversation. Let me first tell you all the hashtags I know. Cervical cancer prevention, cervical cancer health, cervical cancer screening, HPV vaccine, all those things. Just try to hashtags. It'll give you a better understanding and see what's going on. Our guests today, who are they? Mrs. Ivy Ume, who is a cervical cancer survivor, and Dr. Mary Clement Dennis, who is our docky in the house today. Good morning, ladies. How are you?
I'm fine. I'm fine, thank you.
Okay, so now let me see. Who am I going? Let me go first. Ivy. Ivy is a cervical cancer survivor and who has personal experience with the challenges of the disease. She's passionate about sharing her journey and raise awareness about the importance of early screening and prevention. That's exactly what we're talking about. We just said it. Early screening and prevention. Let's start to look at it. Um, and prevention measures. She hopes to be a source of encouragement and support to those facing or going through the diagnosis. You definitely will be one, considering you're going to be sharing your story. I know it's very personal. And who else have we got in the house? We've got Dr. Clement Mary Dennis, who is a dedicated senior registrar or in the department of obst- obstetrics, gosh, you guys, and gynecology with a passion for reproductive health. He has been instrumental in organizing cervical cancer screening programs for various organizations over the years. With a warm and friendly demeanor, Dr. Dennis is also committed to business and humanitarian work, making a positive impact in her community. So today she shares her experience and insight through promoting cervical cancer education and awareness on vital health issues. So thank you both ladies for joining me. Thank you for taking your time out. And to our viewers, sit back, relax. Let's enjoy this conversation. Like I said, it's Cervical Cancer Awareness Month. Cervical cancer is one of the highest killers of cancer patients in low middle income countries. Nigeria is not an exception. Last year, is it the year before? The the rollout started in Nigeria. I think we started the first 2 years ago, and then last year was the second batch. So we should be seeing some improvements, I hope. But let's talk about what the facts are today, and let's get it going. So, ladies, who am I starting with? Actually, let me start with our survivors. You know, me, I like to say because me too, I'm survivor. All of us together. Let's get it together. Um, share a story for us, please. Briefly share a story.
Good morning. Good morning, Dr. Dennis. Good morning, Dr. Clement. Good morning, studio of AIT. Thank you for having me. I really appreciate this opportunity. Thank you so much. So, my name is Ume Ivy. I am an interior decorator and a cervical cancer survivor. So, I was diagnosed of cervical cancer March 8th, 2024. Can you hear me?
Yeah.
Okay,
Yes.
okay.
Yeah.
So, I was diagnosed of cervical cancer March 8th, 2024. So, before then, I've been having watery discharge, slightly watery discharge, and then I was breastfeeding. I have my second daughter. My second daughter was 6 months. I was breastfeeding. So I went for the hospital where I used to go for my antenatal, where I used to give birth to my children, and test was run. At first, they told me it was infection. So they started giving me antibiotics to treat the infection. But after treating the infection, I found out that I was still having this watery discharge again. So when I went back to the hospital, they said I should go for scan. So they did a scan for me, and they said there's something in my womb, my cervix, that maybe I've had a miscarriage. I was like, my child is 6 months. How can I have? I've not even met my husband, so there's no need. There's nothing like a miscarriage there. They said it can happen, something can happen like that, because it was doctor, and I had to listen to them. I don't understand. So they said I would go for evacuation. So they booked me for an evacuation. I went for evacuation. After the evacuation, I was given antibiotic I said I should take it for 1 month, that everything will be fine. So after taking the antibiotic for 1 month, I was still having the watery discharge. And then I went back, I thought I was still having this watery discharge. They said I should go back for scan. So when I went for scan, they said it's still remaining, particles is still remaining in my cervix, that the evacuation was not properly done. So they had to do the evacuation again for the second time. They did it again, and give me antibiotic again to take for 1 month again. So after the 1 month again, I'm still having the same watery discharge, and now it's beginning to become very smelly. So I went back. In fact, this time my husband was very mad. Like, when I went for scan, they said there's still more particle inside. My husband was like, these people are not professionals. So we went back to the hospital. They said then they want to do it again, the evacuation for the third time. My husband was like, let's go to another hospital, since these people does not know what they were doing. So we had to go to another hospital for the evacuation. I tendered the scan result for them, and they said then they will do it for me. So in the process of the evacuation, which is the third time of evacuation, in 3 months, I've done 3 evacuations, not knowing that they were evacuating cancerous tumor. So after the third time evacuation, the doctor said my cervix is abnormal, that I need to see a gynae. In fact, he said I need to see his friend so that he can do surgery for me immediately before it turned cancerous. So I was like, let me go and take the antibiotic, then come back. So I was taking the antibiotic. Before 1 month, I started bleeding. Heavily. That was when I was rushed to another private hospital close to me here for blood transfusion. So in the process of the blood transfusion, they ran some tests for me and nothing was found. They said I should go for scan. It was there when I went for scan, they said that my cervix is abnormal, that I need to see a gynae. So they had to refer me to National Hospital, Abuja here. So when I got to National Hospital, all tests were run. Then biopsy was taken, and it was the biopsy that they did that then said it was a cervical cancer. That was how my journey started.
Thank you for sharing. Doc, are you in one face? Doc, I think this is how I'm going to start this conversation, because this is like a common storyline that we hear, and I think, yeah, that we hear, and it's one of the reasons why a lot of people are really not being that time, because as you can hear, 3 evacuations, over 3 months. As Avia said, she has just started her journey, and because I know what the journey is like, 8 years down the line, it's not a very good start to trying to get through and getting past, and somebody who's just had a baby. So I'm going to start with you. Just tell us briefly. I want to ask you what cervical. Can we add it to this conversation of what you have said? because we can't run away from it. That is Nigerian patients' reality.
Good morning. This is Denise and our beautiful viewers. Thank you for having me. Mrs. Agbot, I'm truly sorry for your experience. Like our hosts have said, it wasn't a sweet one. Truly sorry about that. Cervical cancer is actually the cancer of the mouth of the womb. Just like a layman in the street will understand it. The mouth of the womb is that part of of your uterus, the lower part of your uterus that is between your vagina and your womb where you carry your baby. So that lower part is called the cervix. So this cancer is a cancer of that mouth of the womb. It's only peculiar to women because it's only women that have cervix. Our male counterparts don't have cervix. So, and hence, they cannot have this cancer in their cervix. Surprisingly, globally, this cancer accounts for 602,000 new cases being diagnosed every year and account for 342,000 deaths per annum. That is every year. So it has actually become a public health problem. And what causes it? It is being caused by an infection with human papilloma virus. That's a persistent high-risk human papilloma virus. It is the virus that causes the cancer. It is actually a preventable and curable cancer if detected early. But however, because in the early stage, the patient appears asymptomatic, early screening is often underscored. Hence, the high incidence of cervical cancer in developing countries just as us. Thank you.
So then, in which case, doc, I'm going back to this thing. Sorry, I'm going to come back to the other question. But in
Okay,
this
ma'am.
case, the doctor, she saw a doctor, time 1, time 2, time 3. You know, having the question D and C. That's what she's having. Then tomorrow, if she can't have another child, and she wants to have other children after she's been treated, because may by the grace of God it be early detection at this point, but I cannot comment and you can't comment. However, if it's not early detection, that the doctors have not helped her now, because she actually went there on time and said, I'm having this, they gave you antibiotics, they gave you antibiotics, they gave you antibiotics. Oh, come on.
Yes, ma'am.
I'm just saying that this is our reality, what a lot of
Yes,
women are going
ma'am.
through. So I'm trying to get women to understand, where do they need to draw the line. She had to draw the line after 3 attempts and different hospitals. And then a doctor who knew his onions actually turned around and said, no, go and do this thing. Let's go to this place. Do you understand what I mean? Whereas
Yes,
other people will want to take it on with no knowledge because they are not oncologists and they're not specialists. So how can this be stopped?
okay. For her case, like I said before, oftentimes the early symptoms present as though they are other symptoms we treat like a sexually transmitted infection. We can hear from her story that she presented with vaginal discharge. Most of patients that have a sexually transmitted infection often present with copious vaginal discharge and foul smelling, which most symptoms with cervical cancer. But the only difference is that for cervical cancer, just like when you begin to treat with antibiotics, it doesn't respond because there is an outgrowth occurring in there in that cervix. So in order to boycott this protocol or boycott all this up and down that would delay her diagnosis and further delay her treatment, the best bit is screening, which is the way forward. Hence, I believe that's why we're having this conversation. Screening. And the screening methods are quite simple and cheap also.
So basically, so I'm coming back to some other, but so if she had, after the first attempt and then first treatment and first antibiotics not working, then she had the DNC and nothing. If they had screened her at that point, they would have found that there was something wrong, right?
Yes, please, ma'am.
Okay,
Yes, please, ma'am.
so let's go on with the conversation. I've asked the one I want to ask. So viewers, please take note of what the awareness campaigns are, because I'm not a medical. I will say this one. So Ivy, come on and let's go. So from your views now, how aware are you now, based on what you experienced of cervical cancer and the importance of early diagnosis through screening? But please talk to viewers as to what your, from your view, how aware from your experience do you think viewers need to be now to know how to go forward? Because you are the one that's sitting on the chair, and you are the best person to describe it.
Well, for me, in this case, personally, I feel if I had known that, because I have not, ever since I've been seeing awareness on cancer, I have not come across cervical cancer awareness personally. I only come across breast always. So I don't know anything about cervical cancer, honestly. So it was after my diagnosis, I started doing my research, and I started seeing cervical cancer this, cervical cancer that. Because so what I would like to tell my fellow women is, in the process of you getting when you discover something like this, any kind of discharge, any kind of discharge, be it even smelling, whatever, I will advise you, as you are running your test, probably vaginal swab and all of that, you should do pap smear as well. You should do pap smear, combine it together, do pap smear to be on a safer side. Because if the first time when I went for the test, if they had told me I needed a pap smear, I would have done the pap smear and the vaginal swab at the same time. But nothing like that I wasn't told anything like that. They also said I should do the pap smear, and that was they also said I should do the vaginal swab. That was where my treatment started. But if I had done, like now, I'm telling my husband that these people really do me bad. Because if I had done this pap smear before now, at least I wouldn't have got to the stage of where I was bleeding. Because when I started bleeding, in a day, I take 8 pounds of blood. The first day they took me to National Hospital Emergency, I took 8 pounds of blood, because my blood level was about 12 or so. You
Okay,
understand?
so I think I get it. I think we're getting it. I think. Okay, so before we go very fast, everyone, I need to come back to this drawing board. We have been doing cervical cancer campaign on this channel for long, for 3 years. You see, I think Doc, you will need to combine the words cervical cancer and HIV and HPV together,
Yeah.
because a lot of people have heard HPV, and we don't connect HPV with HIV, with cervical cancer, and I think that's what the issues are. So from yours now, I'm coming. Patient, I mean, what's the level of awareness and understanding of cervical cancer based on what is now available now in Nigeria?
Okay, I agree with her. Patient awareness about cervical cancer is very poor in our country. Very, very poor. Oftentimes in our gynecological clinics, when you see patient and you ask them, because it's part of our biodata, clicking a profile in gynecological clinic, I begin to ask them, Madam, have you heard of pap smear, papilloma smear? They'll tell you, is it pap, is it akamu? Sorry to say that. Say, I've never heard of that. And we begin to, by then it is then we begin to educate them. That is the screening test for cervical cancer, that it helps for early detection and treatment, and thereby prevent the patient or client from dying from the complications of cancer. So the outcome or the awareness for cervical cancer amongst Nigerian women is very poor. Hence, need for more advocacy, awareness in all ramifications.
So then, in which case, what are the main barriers preventing Nigerian women from participating?
Okay, one of the barriers
I want to
is
money. Okay. No, go on. I was thinking of money. Go on.
It's part of it. Okay, so the major barrier is social-cultural barrier. One, these women feel people suffering from cervical cancer have witchcraft, or is a result of their ill doing that God is rewarding them. Why others feel, cultural and because of the cultural norms, they are not supposed to open up to their clinician or to their gynecologist to know about their reproductive health. Apart from that, other barriers is cost. The cost of screening is high. If you compare it to the economy of now, and I've seen several of my clients that I would say, madam, please go and do pap smear. It's a routine screening test for every woman of reproductive health. And she would tell me, doctor, how much is it? I tell him, okay, this is a public hospital, it's just 10,000. Ma, it will shock you the response from our women. They will tell you 10,000 can give my children 3 square meals for 2 days. Why use it? Cancer will not catch me in Jesus' name. You can see how we trivialize things in the country. So the cost also is one of the barriers. And also a lack of facility for the screening test. Most of these women are located in rural areas, and most of the centers we have are located in urban area. So lack of facility for the screening in rural area, and also the cost of transportation. Maybe I'm in Abuja, and most of the women might be in Abaji, what's the other place? Abaji, Buhari, and they need to transport themselves from there maybe to Abuja main city to be screened. And when the money is not there, they will not comfort. So that's also a major barrier. And the other ones like I've mentioned, is a stigma and fears. Or some of them will say, I don't want to be screened. I don't know what the result will be. This test might be painful. I don't want that discomfort or pains of the test. And they will just opt out of it. So those are the major barriers to the screening program. Apart from the awareness that it's not robust at all.
Okay, so I'm going to ask you both of you one word thing. I'm about to close this thing, and you actually have addressed some key things you may not even realize. Short conversations actually bring out a lot more than you can think about. So let's go. Ivy, give me one word, one sentence. What do you want the government to do for you? We can't hear you. We can't hear you. We can't hear you.
Okay, sorry, I mute myself.
Go on.
Can you hear me now?
Yeah.
Okay. When you said one sentence for what the government can do for me now, is it after my diagnosis or after treatment?
For Nigerians generally, one sentence to the government to help us.
They should create more awareness.
Okay.
Create more awareness.
Doc, what would you want the government to do for us?
One thing I want the government to do is launch a nationwide campaign on cervical cancer, prevention, symptoms, screening, and early detection, as this will help to save the life of our women.
Thank you both.
Also, to add to that,
thank you both very, very, very much for joining me today. I got quite a lot of things I have to say. So let's end this program, and I want to tell all viewers this morning. Next month is World Cancer Day, 1st of October. We'll be back live. I don't yet know who we have, and also I'm the president of the Nigerian Cancer Society, Professor Bob Bidemi Omonisi, will definitely be holding a national briefing, a world briefing. I don't know how it's called, a media center on World Cancer Day. So on the 3rd of February. So I'd like to ask all viewers, please tune in, listen to what's going on, listen to what the plans are. From the 3rd to the end of that week, there's a lot of cancer awareness campaigns, screenings and stuff around the country. Please get engaged and get to know about it. This year it is United by Unique. That's the theme for World Cancer Day. Together we fight, together we win. Join us on our social media handles. You'll be able to watch this video on our YouTube channel, either later today or tomorrow, where we would have uploaded it for you to go and get the facts and get the information you want. Other information about our message is very clear. Together we'll fight, together we win.